Hi, I'm Vicki Liviakis, and welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air, and with us today we have plastic surgeon Dr. Elizabeth Lee, and we're going to be talking about teen plastic surgery. Fascinating topic. Later, we'll be taking your calls, answering any questions you might have. Here's the phone number, 800-440-4884. We'll also be posting Dr. Lee's phone number during and at the end of the segment, so be ready to jot that down. And before we get started, any advice we give you today, certainly you'll want to consult your own physician as well. Welcome back to the program, Dr. Lee.
Thank you.
It's back to school time, but back to school means more than, homework and math classes. It means, for a lot of teens, being teased, being bullied.
Right.
Kids can be mean.
Kids can be really mean, and going through the changes that kids have during adolescence is really huge. I don't think there's any one of us out there that would go back to being an adolescent unless we could go back knowing what we know now.
Right, exactly.
And really do it right this time.
Yeah. But I mean, so for a kid who is self-conscious about a body part, for instance. I know kids that, will call, there's a young boy that I know, he has big ears, and they call him Dumbo, and it's harsh.
It's very harsh. Kids are mean anyway, and adolescence is a time where we're trying to deal with all sorts of body image issues related to changing. And if you have something that is really making you a target for a lot of teasing, it can really be incapacitating.
Okay, so let's talk about some of the solutions. Obviously, you're a plastic surgeon. You have some plastic surgery solutions. We want to also discuss that this isn't always the answer.
Exactly. I mean, what's important to understand is that it's always worth exploring what the possibilities are. Just because you go for a consultation with a plastic surgeon doesn't mean that you're taken immediately to the operating room. And parents should always feel comfortable listening to what their children have to say, and then going to a professional who can help tease out the pros and cons of the motivations that the child has.
Okay, well, what are some of the more common procedures that teens will undergo?
Children and teens, will undergo otoplasty, which is ear pinning for very prominent ears, breast reduction, and rhinoplasty, fixing the nose. Those are, I think, the three most common procedures that are done in people under the age of 20.
Okay, and maybe acne, pockmarks.
And there may be more commonly during adolescence. There's the treatment of acne as opposed to just treating the scars. But during adolescence is when we're trying to prevent scarring by treating the acne.
I mean, that seems to be a time, if I can recall, it's been a few years for me. But as an adolescent, you're trying to fit in. I mean,
and you don't want to draw attention to yourself because your breasts are huge, or because you have horrible skin, or because your ears stick out through your hair.
But the body is also going through an incredible upheaval. You're flooded with hormones,
right.
And it seems like they start growing, out of nowhere, like a weed overnight.
Right.
And so at some point, I mean,
well, there are times to do this, and there are times to not do it. I mean, every patient, for instance, who comes in for breast reduction needs to be demonstrating that their breasts are not still actively growing. You don't want to do a surgery on a young woman and have her back to where she was because you caught her, within a year, because you just did the surgery when she was still growing. And there are different sets of concerns about operating on young women before they've had children, and also on making sure that when you do any kind of surgery on a young person, that the motivation is really coming from the child, and because very often there are things happening with the parents. The mother had prominent ears and was tortured, and the child's ears are not that bad, or are not bothering the child. It's important not to do.
Well, let's pick an actor. I want to play devil's advocate for a moment. Will Smith, and he said he was teased. He has those cute ears, and he's made something of it. Obviously, he learned to live with it. So. Like it.
Right. And so that's why it's not for everybody. But the fact is, and there are a lot of people that go around and it doesn't bother them. But that's why it's important to seek consultation with a surgeon to just be able to get the information about what your options are.
So the right person, not just somebody who is technically trained as a surgeon, but also to give the psychological.
Exactly. And I'll tell you, when I do a consultation, I spend at least an hour to start with the the child, with the parents, and what I do is talk and listen.
Well, we're going to continue talking.
Yeah.
We've got to take a quick break, but for more information about Dr. Lee, you can certainly call her at 510-704-2170 or check her out on the web at artfulsurgery.com. We'll be taking your calls. The phone lines are already lighting up. It's a big topic here when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.
Welcome back to Body Beautiful. We are talking with Dr. Elizabeth Lee about teen plastic surgery. We'll be taking your calls with any questions you might have for the doctor. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And our caveat here, any advice we give you today, you certainly want to consult your own physician as well. Doctor, we were talking just a minute ago about, teens are asking these sorts of questions.
They are.
They want to know what they can do. So at some point, when they leave childhood and they're young adults, they want to start making these decisions themselves about changes?
Well, I'm not sure that they actually want to make the decisions themselves as much as that we're seeing a list of questions being generated on some of these websites, such as realself.com, because I believe that they don't feel comfortable talking to their parents about it, and so they're reaching out to online communities of physicians to kind of get some feedback and some suggestions for how they can proceed to have their questions answered and to figure out what's right for them.
And yet, if they're under 18, certainly they have
the parents have to be involved.
Parents have to be part of the process.
There's no question.
Yeah. And so, what do some of the parents ask you when they come?
Well,
the child?
It's interesting because by the time the patients get to me, in most cases, it's been kind of the parents are on board and they've made the appointment. But I think that parents are worried about the health of their children. They're worried about allowing their children to be kind of obsessed with body image, and they need help sorting out what is really medically and psychologically indicated, and what is just, well, everybody wants to look like everybody else because we have all these magazines with these airbrushed models.
Yeah, which are unrealistic. Now, you brought some before and after pictures. These are not airbrushed, but
right. These are real pictures.
Okay, so let's go ahead and roll some of those and get an idea of what we're talking about.
So, this was a patient who suffered all the way through childhood and adolescence with ears that stuck out through her hair, and she said, people used to call her Mickey Mouse. And on the left is the pre-op picture, and we've done it from the back so you don't see faces, obviously for privacy reasons. Right. And on the right is her post-op pictures, where you can see that the ears, are more of a easily hideable position,
and yet subjectively, and it is,
it's very
subjective.
Right.
It doesn't look like a big problem to me,
right? But it's for her,
it became
it's
a focal point.
That's right. And and she did not feel, she was really stuck because she told me, if I wear my hair down, they stick out, my ears stick out through my hair. If I wear it up, then everybody sees them. I'm really stuck.
All right. Was she happy with this?
She was thrilled. She was thrilled. And she said, it's just, I don't think about it anymore, and that's huge.
Okay,
and this is another child who's significantly younger. She was about 11 years old, and she would not wear her hair up at all or in a ponytail, and she only dressed to cover her ears, and she's significantly
and we know
happy.
This much about body parts. The nose and the ears keep growing, so it's not like they're going to stop. So
right, it's not like they're going to stop, but what we've done is change the shape of them so that they're not going to get bigger. But again, that's brings up another point, which is that we want to time the surgery so that the majority of the ear growth has happened already, so that, because you certainly do stunt the further growth of the ears.
All right, we have some more pictures. Let's go ahead and roll those.
Okay.
And this is
this is a breast reduction patient. So, you know, this is a young woman who came in. She's in high school, and she was brought in by her mother. And, you know, she was wearing big baggy sweatshirts. She was walking slumped over. She did not feel that comfortable buying clothes or doing anything. And you know, she had a breast reduction. She came in wearing, you know, those little T-shirts that the kids are wearing, and it's great. She feels completely different.
It was drawing less attention to herself. That's what she wanted. Also, I imagine she can play sports,
run more easily, you know. And then this is another breast reduction patient. You know, when you're a teenager and your breasts are enormous, that's what draws attention, and it's really, really uncomfortable.
And yet, you know, when adults want to go the other way, they want to draw attention, and so there's a dichotomy in all this.
There is an element of, you know, nobody's happy with what they have, but in this case, you know, this patient was very, very asymmetric. So we've done different procedures on both sides, but to get her symmetry, because she was stuffing one side of her bra so that she could wear clothes and not look uneven.
Now, would insurance cover something like this? Because
insurance will often cover something like this.
Okay.
Yes.
Listen, you know what? I promise we get to at least, let's try to get to one of our callers here. Cecilia from Oakland. Good morning, Cecilia. You're on the air. Do you have a question for the doctor? Okay.
Maybe not.
Maybe not. How about Christina, Union City? Christina, are you with us?
Yes, I'm here.
Okay. Do you have a question for the doctor, really quick?
Yes, I do. I wanted to know how long after you've had a baby can you have a tummy tuck, and after you've been breastfeeding, how long you have to wait before you can have a breast reduction?
Right. 6 months before, from the time you stop nursing till we do any surgery on the breast. And tummy tuck, I usually advise patients to wait about 6 months to 9 months. You didn't get all stretched out like that overnight. It's not going to go back overnight. So give yourself a chance to heal.
So the body will do a certain amount of adjusting on its own?
Yes.
Okay. Thank you very much, Christina. Let's move on to Cecilia. Are you with us, Cecilia?
Yes.
Oh, great.
Okay.
Do you have a question for Dr. Lee?
Yes, my question was, I was interested in getting liposuction in my stomach, and
okay.
Yeah, I was interested in getting liposuction in my stomach, and I wanted to know the side effects of it after it's all done.
This, you know, that's a long question. So liposuction is basically a good operation for if you have a little area of fat that no matter how much you diet doesn't go away. It's not a great idea if you have a lot of weight to lose. It's not really a weight loss procedure, and you know, the side effects, as long as your weight is under control, are really relatively minimal, and the operation is easy to heal from.
Okay. Age, does that factor in?
No,
as well,
you know, when we do not age and recovery period probably doesn't factor in. In general, younger people do, you know, heal more quickly than older people, but for other reasons, patients, you know, over age 50 are usually not candidates for liposuction.
All right, speaking of younger people, we will continue our chat about teen plastic surgery. We need to take a quick break, though, but for more information about Dr. Lee, you can call her at 510-704-2170 or check her out on the web at artfulsurgery.com, and when we come back, we'll take more of your calls and talk about teen plastic surgery. For more information about our show, go to cron4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows. Back to Body Beautiful. We're talking with Dr. Elizabeth Lee right now about teen plastic surgery. First, let me remind you that we'll be taking your calls live with your questions, really that have to do anything with plastic surgery. I think we're willing to take those calls. That number is 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you certainly want to consult your own physician as well. And when you consult a physician about plastic surgery, I mean, are there's some people that you say, you know what, you're not a good candidate.
Right.
And what would some of those areas be?
You know, there's this whole thing out there that people are now hearing, body dysmorphic disorder, where the concerns of appearance way outweigh what the physician is actually seeing. These are not patients who are going to respond well to surgery. So for me, looking at somebody and not immediately seeing what their concerns are is
usually a red flag.
In the case with teens, I really need to be careful about who's motivating the procedure. I have had people come in, children come in with their parents, and it becomes obvious that the parents are really very anxious about whatever is going on, and that the child really is not. Or, you know, with adults, you know, I'll have the boyfriends come in and say, I want her to have bigger boobs, and I don't operate on those people. I know that they can find somebody who will, but I won't do that. You're having surgery, and it has to be motivated by the patient.
Okay. Are there any, let's say, times where you say, look, you need therapy, you don't need plastic surgery?
Well, yes, but you know, obviously we have to be careful about that, and I never say it in those words. But my job as a physician is to try to help, and so if you've come into me with a concern about something that you thought a plastic surgeon could help with, it is my job to, as gently as possible, encourage you to go where you need to go to get help.
Okay. Well, how young is too young? We were talking about the body is still growing. Let's say for facial, when does the face stop?
Well, the face grows through early adolescence, and so you know the face grows related to the teeth and the permanent teeth. So we generally don't do a whole lot of facial stuff unless there are functional reasons to do it.
So say for a girl?
For a girl, somewhere, you know, around 13, 14. Rhinoplasties are not usually done before age 16. Doing your ears, though, can be something that we do from age 3 onward, because the majority of head size growth and ear growth is completed by age 3.
Are boys and girls different? Do boys stop growing a little later, maybe?
They are different, but again, it's a very individual thing, and that's part of the assessment that we make when the patient comes into the office. For breasts, you know, for breast reduction in teens, they have to be wearing a stable bra size for a year.